Well, bonjour, mes amis. Pretty good, that's one. I'm learning.
Getting better.
I'm learning slowly, Francois. Hello, my friends, and welcome to Ontario, and thank you for coming here. We've just concluded the first ever Ontario-Quebec Summit. I want to thank Premier Legault and his team for a very productive 2 days of meetings. At this critical time, our two provinces are standing together. We're standing united, and by traveling here, by bringing a delegation from his all-star team, my good friend Premier Legault is helping send a signal. Together, we are sending a clear message, a message of unity and cooperation. My friends, this virus, it has taken its toll. We have seen some dark days, and we're not out of the waters yet. But this summit, it shows us that we are not in this alone. And together, Ontario and Quebec and all of Canada, together we will get through this. So thank you, Premier Legault and your entire team. And the significance of this summit, it isn't lost on any of us. This is historic, because when Ontario and Quebec, when our two mighty provinces work together, nothing can stop us. Together, we are a powerful economic and political unit. And at this critical time, at this critical juncture, solidifying this bond is more important than ever before. Because together, we have more leverage when it comes to fighting U.S. economic protectionism. We have more leverage when it comes to negotiating with the federal government. Together, we are a political and economic powerhouse, representing over 61% of the population and $1.1 trillion in combined GDP. And we're here today to get people and businesses back on their feet. We're here today looking for ways to accelerate economic recovery through infrastructure, renewal, transit expansion, and improving broadband service. We're here today to advance our shared trade priorities. We are one of the United States' top customers anywhere in the world. Together, we conduct $496 billion in two-way trade with the U.S. every year. Combined, our two provinces are the third largest trading partner to the U.S. And right now, we need to defend our businesses from U.S. tariffs and other trade barriers. Ontario and Quebec, we make some of the best products anywhere in the entire world. And we are here today to protect those jobs, the families they feed, and the communities they support. And we're also here today because we need to be prepared for the future. With the federal throne speech on the horizon, it's clear we need to push the federal government for fair, flexible, and sustainable funding for healthcare in this country. Ontario and Quebec, we have been on the front lines of fighting COVID-19, and we need to build stronger healthcare system and stay prepared for any scenario this fall. We want a fair deal for all provinces and territories. We want a fair deal for all Canadians. And that means the federal government needs to step up with an increase in the Canada Health Transfer. I look forward to discussing this proposal with our provincial partners at the upcoming meeting of Canada's premiers. And my friends, Premier Legault and I, we believe that our two provinces, working closer together, we're unstoppable. We have come a long way towards building new bridges, building new partnerships, but we still have a long road ahead of us. And that's why Premier Legault and I have agreed to convene an annual meeting to continue this important work. Thank you again, Premier Legault, for your leadership and your friendship. This has been a historic meeting. Thank you to the people of Ontario, and thank you to the people of Quebec. Now I'm going to turn it over to my good friend, Premier Legault.
Bonjour tout le monde. Je veux d'abord remercier mon ami Doug Ford, le premier ministre de l'Ontario, pour son accueil très chaleureux. Je veux aussi remercier son épouse Carla, tous les ministres aussi des deux gouvernements qui étaient avec nous hier et aujourd'hui. On a eu de très bonnes discussions. Bon, d'abord, évidemment, on a discuté de la crise sanitaire, comment on fait pour mieux protéger les Ontariens, les Québécois. Ça demeure la priorité numéro 1. mais évidemment, on s'est aussi parlé de comment on relance l'économie. La première condition de la relance économique, c'est justement d'empêcher que la pandémie reparte et qu'on soit obligé de confiner. Donc, on a parlé aussi d'économie. Mais avant même la pandémie, le financement des services de santé était déjà, dans toutes les provinces, un problème très important. C'est complexe, mais en même temps, c'est simple. Les dépenses de santé augmentent de 5 à 6 % par année pour offrir les mêmes services, donc, alors que les autres dépenses augmentent de 3 %, les revenus augmentent de 3 %. Pourquoi la santé augmente de 5-6 %? Parce qu'au-delà de l'inflation, s'ajoutent tous les impacts du vieillissement de la population. C'est assez simple à comprendre. En moyenne, une personne plus âgée consomme plus de services de santé. L'autre raison, c'est qu'avec la recherche, on ajoute à chaque année des nouveaux médicaments, des nouvelles technologies. C'est difficile de les refuser à notre population, mais ça fait qu'au total, ça augmente de 5-6 % par année. Quand on additionne les coûts de santé de toutes les provinces, on est autour de 200 milliards de dépenses. Et la part du fédéral qui vient dans les transferts en santé, c'est 42 milliards, donc 21 %. Donc, nous, on pense que ce problème structurel de croissance à 5-6 %, le fédéral doit contribuer davantage. Les contribuables payent des impôts et au fédéral et dans les provinces. Et je le répète, la santé, c'est la seule dépense qui augmente de 5-6 % par année. Donc, c'est un problème structurel qu'on a besoin d'une contribution récurrente du gouvernement fédéral sans condition. Évidemment, je vous donne un exemple. On le sait, on s'est tous dit qu'on devait investir davantage dans les soins de longue durée. On a déjà commencé à investir ces sommes-là. Donc, si le fédéral arrive avec des sommes qui sont seulement dédiées aux soins de longue durée, bien, c'est un problème. Puis les sommes qu'on a eues jusqu'à présent du gouvernement fédéral, c'était des sommes qui n'étaient pas récurrentes. Donc, il faut avoir des sommes récurrentes pour, entre autres, embaucher plus de personnel dans le réseau de la santé. On a aussi des grands besoins en infrastructure et c'est utile d'accélérer la réalisation des infrastructures parce que ça sert aussi à relancer l'économie. On a tous les deux des projets très importants dans les transports en commun. À Toronto, de l'autre côté, on a à Montréal, à Québec, en Outaouais, sur la rive nord, sur la rive sud. Donc, c'est bon pour l'environnement. Je pense que M. Trudeau devrait faire un effort additionnel. D'abord, les programmes qui sont existants, on demande plus de flexibilité, mais on voudrait avoir des programmes additionnels du gouvernement fédéral. Now, in English, good afternoon, everyone. I want to start by saying thank you again to my friend Doug Ford and to his wife Carla. I want also to thank all the ministers that were with us yesterday and today. We had a productive meeting and we agreed on important topics. Healthcare is a high priority for all Canadians, but provinces, they face huge deficit and they are facing structural pressures on healthcare funding. Currently, provinces spend $200 billion in healthcare, and the contribution of the federal government is only $42 billion, which is about 21%. So therefore, we really need Ottawa to do its part financing healthcare in a recurrent and without conditions attached to it. So we need a substantial increase of the Canada Health Transfer. We also need to get more support from the federal government for financing infrastructure, including transit and collective transportation. So in conclusion, after this summit, Ontario and Quebec governments are closer than ever. Doug and I are closer than ever. Probably become Habs fan very soon. We have a lot in common. We fight the same pandemic in the same Canadian context. We share the same urgent need to find a lasting solution to finance healthcare in this context of large deficits. We share the same need to relaunch the economy. Working together closely may just help us. So we are stronger together. Merci. Thank you.
Merci. Thank you, Francois, and we'll take questions. First of all, before I start, what a quality team, and this is a fraction of our great team in Quebec, great team in Ontario. Unfortunately, we couldn't bring everyone due to COVID, but I just want to, again, thank our ministers. Super bright people standing behind me, I'll tell you. They're great people.
Okay, the premiers will take questions. One question, one follow-up. We will alternate between the mics on the floor and the teleconference. If you are joining us by teleconference, please remember to press *1 to ask questions. We will go to mic 1 for the first question.
Bonjour, Natacha McDonald-Dupuis, Radio-Canada. Monsieur Legault, étant donné l'augmentation des cas de COVID au Québec, est-ce maintenant le temps de serrer la vis, comme l'a fait hier la Colombie-Britannique, à certains secteurs là, pour éviter une deuxième vague?
Bien, déjà, le ministre de la Santé a commencé avec la ministre de la Sécurité publique à annoncer que dans les zones qui sont devenues jaunes, on va serrer la vis du côté des inspections, des amendes pour les personnes qui ne respectent pas les consignes actuelles. On n'a pas d'indication que la majorité des nouveaux cas viendraient, par exemple, de bars ou de restaurants. On sait même que la majorité des cas viennent de rencontres privées, individuelles, dans les maisons. Donc, on doit vraiment, de ce côté-là, répéter le message. Je comprends, ça fait 6 mois, il y en a qui sont tannés, mais le virus est encore là, donc on va répéter. Il faut que les Québécois soient prudents, il faut qu'ils portent le masque, il faut qu'ils gardent une distance de 2 mètres et il ne faut pas qu'il y ait des gros parties dans les maisons.
Plus tôt ce matin, le Premier ministre Trudeau a dit que le fédéral serait là pour vous aider en santé, qu'il veut discuter de la question, mais il ne s'est pas engagé fermement là, sur un pourcentage précis des transferts. Est-ce satisfaisant comme réponse pour vous?
Bien, écoutez, d'abord, on s'est entendu aujourd'hui les 2 provinces. On va avoir l'occasion au cours des prochains jours de discuter avec les autres premiers ministres des autres provinces. Je pense que c'est important qu'on fasse un front commun, comme on le fait sur les sommes non récurrentes qui viennent pour la COVID-19. Là, on demande, entre autres, en santé, des sommes récurrentes, donc c'est très différent. Donc, on aura l'occasion, dans les prochaines semaines, de faire des demandes précises. Puis là, on pourra voir, entre autres au discours du trône, la réaction de M. Trudeau.
Okay, we'll go to the phone line now.
Thank you. The first question is from Paula Larigio of Canadian Press. Please go ahead.
Hi, my first question is for Mr. Legault. Bonjour, Mr. Legault.
Bonjour.
Vous parlez du besoin d'une révision des transferts d'une province en santé. Si le premier ministre Trudeau refuse d'augmenter les paiements de transfert, quel levier est-ce que vous avez pour lui porter la main? Et si Ottawa refuse encore, quel serait l'impact sur les finances publiques du Québec? Est-ce que ça prendrait des hausses d'impôts ou des baisses de services en santé ou d'autres mesures?
Bien, il y a effectivement un problème qui est très concret. Là, sur 200 milliards de dépenses, il y a une augmentation annuelle de 5-6 %. Ça veut dire qu'on parle jusqu'à 12 milliards d'augmentation. On ne peut pas en financer 80 % avec à peu près la moitié des impôts. On a besoin de l'aide du gouvernement fédéral. Je pense que pour tous les Canadiens, en Ontario, au Québec, partout, la santé, c'est une priorité. Donc, je pense que le gouvernement fédéral devrait comprendre. Mais effectivement, c'est essentiellement une décision qui va être politique. Donc, M. Trudeau doit reconnaître que la santé, c'est une grande priorité pour les Canadiens. Puis, on ne peut pas continuer à partager la facture 20 %, 80 % pour les provinces.
And my follow-up question is for Premier Ford. Why isn't the province taking ownership of reporting COVID cases in schools like it did for long-term care homes, rather than putting that responsibility on school boards, which are already struggling with all the other burdens of reopening schools. Aren't you taking the risk of there being a lag in the reporting and of that causing further problems down the line?
Well, we will be reporting moving forward. This is our second day now going back to school, and I know they're rolling this out over the next week or two, but we'll be reporting it. As a matter of fact, I think it's so important that we report every single case, as we did with long-term care. We'll do the same in schools. I'll just remind you, even before school opened, I was reporting on how many kids under 19, and that was concerning when I saw numbers of 20, 21, 25 the other day for kids under the age of 19. So I believe in being transparent. I'll report it all day long, and we'll keep people abreast of what's going on. I've said from day one, what I know, you'll know, and that's the way we've been moving forward since March 15th or whatever date it was.
Okay, we'll go to the floor now. Mic 2, Colin.
Hi there. This is for both premiers. As you know, BC is rolling back their reopening, especially with nightclubs and banquet halls. I'm wondering if you see this as a sign to come for the rest of the country, and are there any active rollbacks being considered in either province right now?
Well, I always get the advice off our health experts and Dr. Williams. Numbers dropped a little bit, but until we get below 100 again, I don't feel 100% comfortable. But we'll take the advice off Dr. Williams and our health team, and they'll decide when we're going to be rolling things back, or if we are. Hopefully, we won't. If everyone focuses on the guidelines and protocols, then we shouldn't have a problem. Because once it gets in the community, that's when it really affects the school. So I'm concerned about it, and we're keeping an eye on it, very much so.
Yeah, regarding the new cases in Quebec, most of them are not coming from bars. So I think we have to look at real solutions. Right now, main problems are coming from private gatherings. So that's where we have to ask the population to respect the 2 meter and to wear a mask and not have parties with many people.
Premier, I know you say that that's the same issue here in Ontario. A lot of private parties. I think yesterday the Associate Medical Officer of Health said we've seen them at churches, weddings as well. I'm wondering, I mean, people are just simply following the rules. I mean, the rules are 50 indoors, 100 outdoors. Are you ready to roll back those public gathering restrictions to make sure that people aren't having these parties?
So all 34 chief medical officers of health can change those rules under Section 22 of the Health Act. And I encourage them if they feel that there's an influx. I understand the mayor, and I know Mayor Brown's doing a phenomenal job in Brampton. And I don't mean to call Toronto or Ottawa or Brampton out. It's just that's where the cases are. If they want to roll it back from 100, they have the authority to do that. They know they have the authority to do it. And if they feel comfortable in doing it, God bless them, roll it back. But I'll take the advice off our health table and Dr. Williams and our Minister of Health, as we have right from day one.
Okay, we'll go back to the teleconference line.
Yes, the next question is from Hugo Dion-Larose from La Presse.
Oui, bonjour. Monsieur Legault, alors que cette deuxième vague semble commencer à prendre forme au Québec, est-ce que c'est en ce moment le bon timing, comme on dit à Toronto, pour faire un sommet avec l'Ontario et parler de relance économique?
Bien, on n'a pas parlé seulement de relance économique, on a parlé justement beaucoup de santé, entre autres de financement en santé. On n'avait pas tous les ministres et puis on a respecté le 2 mètres, on a porté des masques dans les rencontres avant de s'asseoir. Donc, on a respecté les consignes. Je ne pense pas qu'on a pris de risques là, depuis hier. S'il y en a un de nous autres qui avait la COVID, je ne pense pas qu'il l'ait transmis à qui que ce soit.
Et sur les transferts fédéraux en santé, là, donc vous voulez faire front commun avec Ottawa pour qu'ils augmentent. Est-ce qu'à ce stade-ci, dans vos discussions avec M. Ford et les autres premiers ministres, vous excluez, par exemple, un nouveau pacte fiscal avec le fédéral, où le gouvernement fédéral pourrait, par exemple, transférer une partie de son champ fiscal aux provinces pour qu'ils financent eux-mêmes entièrement et pleinement ces dépenses en santé?
Bien, on sait que dans le passé, il y a déjà eu des transferts de points d'impôt. Le problème, c'est que les points d'impôt rapportent une croissance d'à peu près 3 par année, alors que la dépense en santé augmente de 5-6 par année. Donc, même si on réglait une partie du déséquilibre fiscal, si on peut dire, par un transfert de points d'impôt, le problème continue de s'empirer avec les années parce que la croissance de la dépense santé est de 5-6 par année. Donc, je comprends bien, là, si on regarde toutes les dépenses du fédéral puis des provinces, les revenus augmentent de 3 les dépenses augmentent de 3 donc tout va bien, sauf pour une dépense, la santé. La santé, bien, actuellement, on a 80 qui est assumé par les provinces, seulement 20 par Ottawa. Donc, même s'il n'y avait pas de déséquilibre fiscal, il y en a un qui se crée à chaque année, juste avec la croissance des dépenses de la santé.
Okay, we'll go back to the floor, microphone 1.
Premier ministre Legault, bonjour. Ce qu'on craignait se passe actuellement au Québec, entre autres au niveau des tests. Il y a des parents qui se font dire d'aller tester leur enfant. Ils arrivent à un endroit, ils ne savent pas où aller, ils ne savent pas où se pointer. Entre autres, à Saint-Lambert aujourd'hui, on est allé pour faire des tests. On a manqué de tests. Il y a des dizaines de personnes qui sont parties bredouilles à la maison.
Bon, il faut comprendre d'abord qu'on a réouvert les écoles il y a quelques jours. Chaque école au Québec a un centre de prélèvement qui lui est assigné. Donc, il peut y avoir quelques ajustements, comme ça s'est produit à Saint-Lambert, où on doit peut-être préciser l'endroit, préciser le volume qui est disponible. Évidemment, on essaie aussi de transporter les équipements puis le personnel vers là où il y a des éclosions. Donc, on s'ajuste au fur et à mesure, mais je pense que de façon générale, là, dans la grande majorité des cas, les écoles savent très bien le centre de service qui est assigné pour les tests.
Ça a fait l'objet de menaces au cours des derniers jours. Est-ce que les gens vont trop loin? Est-ce que ça va trop loin?
Bien, écoutez, d'abord, je fais confiance à la Sûreté du Québec là, pour ma protection. Maintenant, bon, je ne veux pas rajouter de l'huile sur le feu, là, mais il y a des personnes qui croient qu'il n'y a pas de virus. Là. J'essaie de répéter qu'il y en a un virus et qu'il y a eu des décès. Donc, bon, la pédagogie, répéter.
Okay, back to the teleconference line.
Thank you. Lucas Meyer, News Talk 1010.
Thank you very much. Bonjour, Premier ministre Legault. Bienvenue à Ontario. But my question is for Premier Ford. Just to go back a little bit with what Colin was asking, Premier, there are specific things that are being requested of you. For example, Mayor Tory said this morning perhaps the province should look at ordering bars and restaurants to close at midnight, for example, similar to something that was going on in British Columbia. Would the Ontario government do that?
Well, again, I always consult with Dr. Williams and our health team, but my message to Mayor Tory, you have the power to do it. Do it. If he wants it closed, close them down. You know, I can't, when there was, I think, 16 regions in Ontario without one case, I can't do that right across the province, and that's the reason. We've been going region by region, but all the power to Mr. Mayor Tory, I should say. He knows he has the authority to do it. Do it. Do it tomorrow. Section 22. Close down the bars if you want to do it. And that goes for any other region, be it Ottawa or Toronto or Brampton or anywhere. They have the authority to do it, so I encourage them. If they want to do it, by all means, I'll support them.
Kind of a two-part follow-up to that, though, Premier. Is this a really good sign if you have certain, local officers or local mayors saying the province should do this, and then you're saying, well, if you want to do it, you should do that? If you could address that, but also, if the province is going to roll back measures, is it going to be in these more specific ways that British Columbia is doing, as opposed to completely referring back to stage 2?
Well, again, we aren't there. I don't think we're even close to being there yet. But again, it could spike up overnight. It's concerning, and I will take the advice from our health table, which I always have, and through our Minister of Health and Dr. Williams. That's who I'm going to take the advice off. But again, we have a large province of over 14.5 million people, massive geographical area, similar to Quebec. Actually, Quebec's is even larger geographically. It's really up to each region, and that's why we broke it down. When we opened it up in regions, then I encourage anyone who has a concern, be it any of the large cities, you're the mayors. Make a decision. We'll support you. But to say that I'm going to close the whole province, it's unacceptable. I wouldn't close the whole province when, again, whatever 16 regions don't have one single case. It's not fair to the rest of the province.
Okay, we'll go to mic 2 on the floor.
Hi, for Premier Ford, I think a lot of people will be happy to hear that you're releasing information on school outbreaks, but what about workplace outbreaks? You know, Alberta and BC have been releasing that information, so why isn't Ontario?
Well, again, we've released the numbers every single day, and we've never had a request for the exact locations. If you're saying, should I target certain companies if there's an outbreak in a company, I don't believe in targeting companies, because if there's one case or 2 cases, if there's a massive outbreak, I think the media will cover that. But we're there to support the companies, and that's one of the reasons we're here today, about focusing on economic development, getting people back on their feet, focusing on infrastructure and transit that we're in desperate need of. And of course, nothing happens on the economy unless we have a healthy economy. That's why we need the Canadian health transfers increase. We need the support from the federal government. I got to give a shout out to the federal government. They've been very, very supportive to all of us. So thank you to the federal government. But we need their support. As Premier Legault said, the federal government's paying anywhere from 22, 21%. And we're picking up the balance of 78% of the health transfers. And keep in mind, that wasn't always this way. Years ago, it was almost 50-50. And over the years, not one government, by the way, it's been everywhere from the Conservatives, the Liberals, kept declining and putting the weight of the world on the provinces. And over the last period of COVID, healthcare has just skyrocketed. I can speak for Ontario, is absolutely skyrocketed. And it's going to escalate constantly, healthcare. So we need a strong healthcare system to have a strong economy. And that's what we discussed here today.
Thank you. Speaking of the federal government, I wanted to follow up on last week's court decision ruling your anti-carbon tax stickers attacking the plan unconstitutional. So can you just tell us what you make of that, and if your government will plan to appeal?
Sure, we'll bring that to cabinet. I'll talk to the Minister of Energy. Thank you.
Okay, we'll go to the phone line.
Francois Carabine, Journal Metro.
Oui, allô, excusez-moi. Bonjour, ma question s'adresse au Premier ministre Legault. D'abord, j'aimerais vous entendre sur une proposition de Québec solidaire qui a été faite ce matin, c'est-à-dire de créer une espèce de banque de jours de congé, de 10 jours de congé pour les entreprises québécoises, pour les employés qui devraient s'absenter du travail. Est-ce que c'est une proposition qui vous intéresse? Et dans la perspective où vous alliez chercher plus de transferts fédéraux, est-ce que ça pourrait être des sommes qu'on va chercher justement dans les transferts?
Bon, déjà, le gouvernement fédéral a annoncé qu'il va financer une banque de 10 journées de maladie pour tous les travailleurs. Bon, le montant va être transféré aux provinces. Le ministre du Travail au Québec, Jean Boulet, va mettre en place un système. Donc, c'est une question de temps là, que ça soit mis en place, que ça soit financé à 100% par le gouvernement fédéral.
Poursuivi, vous parliez de l'importance aussi de financer le transport en commun. Pour l'instant, il y a un 400 millions qui a été versé dans les entreprises de transport en commun au Québec qui ont subi des difficultés depuis le début de la pandémie, on va le dire. Qu'est-ce que vous désirez de la part du gouvernement fédéral? Est-ce que vous voulez que ces sommes-là soient doublées, triplées?
Bon, on a déjà convenu d'une entente. On est en train de finaliser son application municipalité par municipalité, mais il y aura des sommes importantes qui vont être versées aux municipalités, incluant pour le transport en commun. Ce sera une somme, par contre, qui sera non récurrente pour la durée de la COVID-19, donc de la pandémie. Donc, déjà, là, le fédéral a dit qu'il était intéressé à financer avec nous. Donc, on est en train de finaliser. On devrait, au cours des prochains mois, annoncer des sommes importantes aux différentes municipalités, entre autres pour le transport en commun.
Souhaitez-vous voir plus de fonds au-dessus de ces 400 millions?
Non, c'est plus que 400 millions. C'est une entente qui est beaucoup plus importante que 400 millions. Donc, ça sera annoncé dans les prochains mois. Mais on a déjà convenu avec le gouvernement fédéral de sommes qui vont être versées aux villes pour le transport en commun, puis aux municipalités pour couvrir les dépenses qui sont associées directement à la pandémie.
Okay, we'll go back to microphone 1.
Bonjour, hi, Étienne Fortin-Gauthier avec TFO. Mr. Ford, you really wanted Quebec to adopt the tracing app and understand why Quebec is not adopting it. Did you convince Mr. Legault?
Well, you know something, I'm going to pass that over to Premier Legault. You know something, we're pretty good with Shopify, and every province is unique, but by all means, I'll pass that over to Premier Legault.
Yeah, right now, there's a consensus in Quebec. The three opposition parties are against this tracing application. They say that it can. We can end up having some personal information that would become public. I understand very carefully and very correctly that it may be not the case, but right now we'll look in the next few months about what we can do. But for now, there's a kind of consensus at the National Assembly in Quebec that we don't want to go this way because of personal data.
So we should be worried in Ontario then. But my next question en français. Hier, vous dites de garder les 2 mètres, vous respectez les 2 mètres. Il y a une photo qui a fait beaucoup parler de vous deux avec la bière, pas de masque, on fait le chin-chin. Est-ce que vous avez respecté vraiment et envoyé le bon message aux citoyens avec cette photo-là?
Bon, d'abord, ce qui est important de dire, c'est qu'on a respecté le port du masque jusqu'à temps qu'on soit assis à 2 mètres. Bon, le chin-chin, d'abord, on n'a pas cogné les verres, mais on peut toujours faire plus attention.
Oui, donc c'était une
on peut toujours faire plus attention.
Sans envoyer le mauvais message.
Nos bouches sont restées à plus de 2 mètres.
Oh, c'est ça. Merci.
We'll go back to the phone line.
Thank you. The next question is from Farah Morali, CBC.
Hi there. This is a question for Premier Ford. I just had a question about sort of some of the messaging we're hearing from your government, from health officials. There seems to be a lot of emphasis on large gatherings, private gatherings, weddings, things like that. Have you and your health officials seen specific data that suggests this is where these new infections are coming from versus, bars, restaurants, and nightclubs?
Well, we have a conversation with the Chief Medical Officer of Health, and that's where we hear it. I haven't asked him to show me actual documentation. I believe Dr. Williams when he tells me these cases, when they trace back to the cause. And all I'm trying to ask the people, and the vast majority of the people, like I'm talking 99% of the people are following protocols and guidelines. It's just a few areas that we're having a little issue with, not everyone. So I just ask people to follow the protocol and the guidelines. It's just so important to move forward with the economy, and until we get everyone feeling confident they can get back on the transit system here in the Toronto and the Greater Toronto area. That's all we're asking. And the thing that we need to fix, there's a system that's broken, and we need the support of the federal government. So right now, there's been 622 cases. The police have went to certain areas for quarantine. They've looked for people that are supposed to be quarantining, and they get there and they aren't there. So they aren't following quarantine rules. Since it's a federal quarantine order, when the OPP or any of the police, it's combined 622 police services across Ontario, they go to a federal quarantine officer, and they determine if those incidents should be charged. And only 2 have been charged. The system is broken. I need the help of the federal government to make an amendment or change it. Why have our police going around checking to see if people are quarantining if they aren't going to follow up with with a charge. So 622 cases, only 2 have been charged. The system's broken. We need to fix the system.
And as a follow-up, this is for both Premier Ford and Premier Legault. You're joining forces to call for more money from the feds for provincial health care. If you do get that money from the federal government, what specifically are you going to use it on to help with the potential second wave?
But I think it's not directly related to the second wave or to the COVID-19. It's a problem that we're facing since many years. Many years ago, when I was Minister of Healthcare, I remember having discussed that with Tony Clements, who was at the time Minister of Healthcare in Ontario. So it's not a new problem, but it's a problem that is increasing every year and increasing because of the expenses related to the COVID-19. But because of the aging population, because of new drugs, new technology, we need more help from the federal government if we want to, we have to share the burden of this spatial increase, the only expense in both governments, province and federal, that is increasing faster than revenue.
And there's a backlog here in Ontario, over 180,000 backlog surgeries, and we need to ask our docs with a collaboration with the hospitals and the docs to work some overtime, and not to mention long-term care. There's just an endless list of areas in healthcare that we need to put more funds towards, and we'd appreciate the support from the federal government. And you know, we got together today, yes, to talk about the CHT, but also to talk about infrastructure, broadband. Broadband, there's no infrastructure in this country that can change people's lives than broadband can. Living up in rural areas, no matter if you're a business or if you're learning online for school, we have to give all the people of Ontario the same access as people in larger urban areas. And then obviously we're talking about part of the infrastructure is transit. We have one of the largest transit projects in North America, $28.5 billion. Minister Mulroney has been working her back off on this project, and we have to get it moving, and we need to support the traditional 40% funding that comes with the majority of the transit projects we've ever seen. We need their support.
Okay, we'll go to microphone 2 on the floor.
Thank you. And Premiers, I believe you just touched on this, but can I just clarify with you that the increase in the health transfer you're looking for, this is a permanent, ongoing increase, not just to get you past COVID-19. And what percentage of an increase are you looking for, or do you have a specific dollar amount in mind?
Well, Francois and I, we wouldn't do anything without consolidating with all the premiers of all the provinces and territories. We've worked extremely well together as a great unit. We all get along extremely well. This is more than just the CHT today. This is about getting the 2 largest economies in the country back on their feet, driving economic prosperity, attracting businesses from all over the world, competing against the U.S. protectionism that we're seeing, encouraging companies from around the world to open up in Quebec and Ontario and thrive and prosper. That's what this get-together was. This is a historic, I can't stress it enough, this is a historic meeting between 2 mighty provinces, economic giants in Canada, that I can't, I've been in politics quite a long time, I can't remember this ever happening again. So I'm so grateful. The relationship, not only Francois and myself and Isabel and Carla are getting together, but our ministers here. They've been in meetings over the last 2 days, and no matter if it's business or politics, in my opinion, it's all about relationships. And I have a great guy standing beside me right here. He's a champion, private sector mind. He gets it. He understands how to get the economy going. So I'll pass it over to you, Francois.
Yeah, but the quick answer is it's too soon to give you a figure. We first need to talk to the other premiers. It's a question of respect. It's a question of also agreeing together of what we will ask to the federal government. But don't worry, we'll put a figure on the table very shortly.
already touched on my follow-up question about have you already spoken to the premiers, other premiers about this, but I'm hearing somewhat of a mixed message, specifically on this increase in the health transfer. Premier Legault, you mentioned that you still have to sit down with the other premiers and sort out the percentage to see. Premier Ford, you were talking about how you were implying that this has already been something that's been in the works. So
let me correct you. Absolutely not.
Okay. So
yeah,
where are we then with the other provinces?
Well, we have to sit down, as we always do, and to make sure that every single province is on side. Quebec and Ontario do not dictate the rest of the country by any means. We've always been collaborative. I've always, myself and Francois, when we're on these meetings with the premiers, we're always voicing our opinion to take care of the smaller provinces and the territories. I've mentioned it almost every single conversation when we have the federal government on these calls as well. But by no means have we ever made a decision without the approval of all the premiers. So it's a multi-pronged approach. We're talking economy, infrastructure, transit, and obviously CHT that affects everyone right across the country.
To be clear, we already have a unanimous decision between the premiers of the different provinces that the top priority is to increase the CHT. Now we have to agree on how much.
I have to give a shout out to Premier Pallister. He's been leading this charge long before Premier Legault and I were even elected. So to Premier Brian Pallister, he's a champion. He's been focused on that. Every time if we get off track, he brings us right back on the CHT. So to be very frank, when it comes to CHT, he's a true leader amongst the premiers.
Thank you.
Okay, last question from microphone 1, Laura.
Hello. Bonjour. The federal government has already pledged $19 billion for Safe Restart, $2 billion for education. They're facing a $343 deficit, we think. What is it realistic to expect that they will be increasing federal health transfers in that economic context?
Okay. The first thing we have to understand is the difference between recurrent and non-recurrent expenses. Most of the expenses that were done by Justin Trudeau since 6 months were non-recurrent expenses. Now, if you hire more employees in the healthcare system, it's not a non-recurrent expense, it's a recurrent one. So it's very nice to say, thank you for the check for this year, what do we do next year? And we know also that the problem is increasing year after year because of the increase of 5 to 6% on a total budget of $200 billion. So it's a lot of money. So what we're asking now to Mr. Trudeau is, what about next year, in 2 years, in 3 years from now? What do we do with this problem that was there before the pandemic?
People are looking for certainty. Provinces, when they're setting their budgets, one of the largest tickets that we have is the healthcare. We've spent in excess of $8 billion more just over a short period of time, from $64 billion up to $72 billion. We need their support traditionally, going back to maybe in the 70, 76, 78, 80. They used to pay a larger percentage, and nothing's more important to the country than healthcare. And I'm very, very grateful for the federal government. I don't think there was a press conference that I did as they're giving us the money that I was thanking them, praising them, and we're very grateful. But we need their support. As I always say, they have the printing press. We don't. No province can go it alone in healthcare nowadays.
And on the economy, how crucial is it for you to keep the economy going? Because on the one hand, you're saying we want to get the economic powerhouses back in these provinces. On the other, you're kind of admonishing people for gathering in groups when they're allowed to. So do you think you're sending mixed messages here, that you want people to follow rules that they are following, but at the same time, you don't want to have to roll things back?
One thing is clear, we don't want to come back closing companies like we did last spring. That would be terrible for the economy. But asking people to wear a mask, to respect the 2 meters, to be careful in gatherings, I think we can do that as a society and make sure that we continue to relaunch the economy.
And I just want to clarify something. I do not go after anyone unless they're breaking the rules. If someone's following the guidelines, God bless them, good for them. But that wasn't the case. There were 175 people up in Muskoka at an area that the OPP drove by and saw everyone without face masks. There's been certain other events happening that people aren't practicing social distancing, aren't wearing face masks. And as to tie that into the economy, you know, we have to make sure that we create the environment for companies to thrive and prosper. They're hanging on by their fingernails right now, a lot of companies, and we have to create the environment between two provinces to make sure that they can get back on their feet, they can be prosperous, they can make money, hire more people. And I always say when companies prosper and grow and thrive, so do the people that work there. Prosper, thrive, and grow. But I don't think any premier, any mayor, any elected official should ever stop, if you want to call it preaching or whatever, about making sure the golden rules, social distance, and make sure that you're wearing a face mask and don't go into large parties. You know, that's the only time I get upset, when I see people breaking the rules. It's very simple.
Okay, that concludes today's press conference.
Thanks, everyone. And again, I want to thank our friends from Quebec. Thank you so much.
Thank you to you for the warm reception. We go this way.
Thank you.